Chapter 1. What is lupus? Lupus is an autoimmune disease that causes the body to fight against itself. This happens when the immune system becomes overactive and destroys healthy cells, therefore causing complications in the kidneys, joints, skin, lungs, heart, and brain. Both men and women can be diagnosed with lupus. However, 90% of persons diagnosed with the disease are women ranging from the age of 15 to 45. Younger children and older people are known to be diagnosed with the disease as well. Lupus is very prevalent in African Americans, blacks, Hispanics, Asians, Native Americans, and Caucasians. The primary cause of lupus is unknown. However, it is believed that congenital traits and environmental factors contribute to a person having the disease. Because of the fact that lupus is more popular in women than men, and some women tend to have flares during their menstrual cycle or while pregnant, doctors are convinced that hormones play a part in provoking the disease. It is thought that lupus cannot be cured but only treated. How to determine the type of lupus? Lupus can be classified as systemic lupus erythematosus, SLE. This is the most common and severe form of lupus, and as the name systemic suggests, it affects the systems of the body. What most people refer to as just lupus is actually SLE. Discoid lupus erythematosus, DLE. Discoid lupus affects areas of the body such as the skin, face, and scalp in the form of red coin-shaped lesions, sores, appearing on these areas, or with the loss of pigmentation of the skin. DLE never attacks internal organs. Drug-induced lupus. This refers to a form of lupus caused by taking certain medications. The symptoms of drug-induced lupus are similar to those of SLE and DLE. However, with drug-induced lupus, the symptoms generally stop after the drug is discontinued. Neonatal lupus. Neonatal lupus is the most uncommon form of lupus and is found in a newborn and possibly in the fetus. This occurs when a mother diagnosed with lupus passes on the disease antibodies to the child through the placenta. Skin rashes and heart and blood problems are the common indication of neonatal lupus. However, these symptoms generally disappear around the time the child turns 6 months old. Signs and symptoms. Lupus symptoms vary from case to case and can be either moderate and impermanent, or extreme and continual. In order to properly diagnose and treat lupus, you and your doctor have to be aware of the signs and symptoms of the disease. These include, but are not limited to, fever, extreme fatigue, loss or gain of weight, swollen glands, nausea and vomiting, headaches, seizures, hair loss or alopecia, easy bruising, aches and pains, arthritis in one or more joints. Your joints hurt and are swollen, especially in the early morning. Ulcers in the mouth and nose. Malar rash, commonly called butterfly rash, a rash extending from the bridge of your nose to the cheeks. Anemia. Photosensitivity, an allergic reaction to the sun and any other ultraviolet light. How to diagnose lupus. It is very important that lupus is diagnosed properly due to the fact that other diseases are known to show similar symptoms to lupus. Therefore, upon discovering that you possess any of the signs or symptoms of the disease, it is essential that you visit a doctor immediately. In order for you to be diagnosed with lupus, you must have at least 4 of the symptoms common to the disease and your doctor will perform other tests to check if you have a positive anti-nuclear antibody, ANA test result, you have a very high erythrocyte sedimentation rate, ESR, you have anemia or a low platelet and white blood cell count, you possess certain harmful enzymes in your liver and kidney, you show protein in your urinalysis, and you have a false positive result for venereal diseases such as syphilis. It is advised that you get a second and even a third medical opinion to see if all the doctors you visited have come to a common diagnosis. How to treat lupus. After you have been diagnosed with lupus, the next step is to treat the disease. The aim of the various treatment plans is to decrease the high level of activity in the immune system and prevent or stop inflammation of body systems. The dosage of medications, level of intensity, and treatment methods vary based on the severity with which you have lupus. Before starting any treatment regimen, be sure to know if you are allergic to any medications. Lupus can be treated by the following methods and medications: NSAIDs, or non-steroidal anti-inflammatory drugs. NSAIDs are commonly used to minimize inflammation, e.g., ibuprofen and aspirin. Common side effects are stomach problems including bleeding and ulceration. Corticosteroids. Corticosteroids are also used to prevent inflammation, e.g., prednisone. Side effects include striae, stretch marks, blood coagulation issues, fragile muscles, weight gain, mood swings, and heightened development of body and facial hair. Immunosuppressants. These drugs help to restrain the activity of the immune system, e.g., Cellcept and azathioprine, such as Imuran. Side effects associated with immunosuppressants are nausea, loss of appetite, easy bruising, liver damage, sterility, the risk of developing cancer. Chemotherapy. Chemotherapy seeks to aid in eradicating the abnormal characteristics of a patient's cells without actually destroying the cells. The side effects of chemotherapy are anemia, low white blood cell count, nausea, vomiting, susceptibility to other illnesses, and issues with blood coagulation. Anti-malarial drugs. In lupus, anti-malarial drugs are used to treat skin rashes and lesions, and also are used to help reduce fatigue, e.g., hydroxychloroquine, such as Plaquenil. Common side effects are nausea, stomach cramps, hair loss, visual problems such as blurriness and temporary blindness. Stem cell transplant. Stem cell transplant is very expensive and is new in treating lupus. It involves using your own stem cells to improve the activity of your immune system. The side effects of stem cell transplant include anemia, change in appetite, susceptibility to infections, and infertility in some cases. After reviewing all the ways in which lupus can be treated, it is the responsibility of you and your doctor to choose the treatment regimen that will work best for you. What is a flare? A flare, as it pertains to lupus, is the emergence of symptoms that last anywhere from a week to several months. A flare can be slight, in which case symptoms come and go, or it can be severe, causing hospitalizations and various health problems such as coma, stroke, heart attacks, lung and kidney failure. It is therefore very essential to know how to manage your flares, which we will discuss later. The period in which your lupus becomes inactive is known as remission. During this time, you may show little to no symptoms of the disease and take little to no medication. There are persons who may go into remission after a few months of treatment, while it takes others years for their lupus to be in a remitted state.